another edition of Your Therapist Needs Therapy podcast, where sometimes multiple, sometimes just me, therapists talk about their mental health journey and how they navigate mental wellness while working in the mental health field. I'm your host, Jeremy Schumacher, licensed marriage and family therapist. Licensed, might I add, in the state of Wisconsin, which is the topic of our episode. It's the topic of the episode today. Today, we are going to talk about the recently released action plan for Wisconsin's mental health. I don't want to spoil it because I'm probably going to record for like an hour here. So please listen. Like and subscribe. Leave me a review wherever you're listening to podcasts. If it's on Apple, I won't look at it because I'm protesting and have been for however long I've been protesting Apple products, but everywhere else I'll probably see it. I don't want to spoil it. There's a bunch of good stuff, and there's a bunch of stuff that I don't think will matter. There's a lot of fluff because it's the government, I guess, and I think if you listen to the podcast or you watch my YouTube or know me personally, I'm paradoxical in a lot of ways, but leftist, right? Like in an ideal world, I'd be a pacifist. In a more ideal world, I'd be an anarchist. Like I think there are things that I talk about a lot on current events and politics and how it intersects with like religious trauma and other stuff, systems theory, stuff like that. Things that I'm spent my whole career working on. But one of the things that shapes my career is I've spent my whole career working in the state of Wisconsin, and I'm not a fan of the government, right? Pink Floyd's my favorite band. So I have a Pink Floyd poster. If you're watching on the YouTubes, there's a poster for The Wall behind me. There's a poster of body art for a bunch of Pink Floyd albums behind me. Also Lord of the Rings, which is oddly pro-monarchy, I guess. So, paradoxical. I'm not a fan of the government. Pink Floyd song, Mother, Should I Trust the Government? And whenever it's performed live, the audience always yells back really loudly, no! Because of course not. Is the state government better or worse than the federal government? I don't know. I shrugged. I like Tony Evers as the governor. I think he's done a bang-up job in a really hard position of having a state that's one of the worst gerrymanders until recently it got fixed. Is still gerrymandered, right? It got fixed from how bad it was, but it's not like we have actual democratic representation in our state. The state legislature is pretty much full of sycophants and morons who have little R's after their name. Because again, there's a lot of rural people who are represented at the state legislature level. That doesn't necessarily reflect where the majority of people actually live in the state of Wisconsin. It should be that land doesn't vote. But again, our country was founded sort of on the idea that land owners get to vote because racism. So, is the state action plan going to fix a ton? No, it's not designed to, I guess. So what I'm saying in a very roundabout way is let's temper our expectations. And I'm going to offer some criticism too, because of course I am. I was raised by English teachers who read all of my papers with a red pen in hand and slashed a bunch of stuff. There's stuff that I think they're underplaying and or missing, or maybe it's politically expedient to not talk about it. I don't know. I'm not a politician. And when I was in higher ed, I was real bad at playing the politics needed to exist in higher ed. So I'm not that person. I am a mental health professional. I'm somebody who works with this on a regular basis. I've been in the mental health field for 17 years, which is wild. I just don't think of myself as being that old, but here we are. And I have thoughts. So let's get into it. I will share this with you. If I can. Yeah. If you're watching on YouTube, obviously that's going to make a lot more sense if you're listening to the podcast, because it is a podcast after all. After all, yeah. I'll read it to you. So, you don't need to be seeing it. But if you're playing along at home with the visual version, you'll see Wisconsin's Mental Health Action Plan up on your screen. This came out May 2026. Something I think a lot of people don't know is when you're a licensed professional, and this is going to derail the whole episode. There's a lot of things wrong with licensing and credentialing. For sure, 100% gatekeeping, institutional racism, systemic racism, systemic misogyny, patriarchy. Like there's a bunch of stuff. It's needlessly tedious and whatever. It's also woefully underfunded, and I still think necessary until we have a better system of community building and managing things on, I would say, a community level. As human beings, things like credentialing boards and state licensure matter because a lot of harm can get done otherwise. And again, the credentialing and licensure process can be harmful in and of itself, and credentialed and licensed people also do harm. There is no way to eliminate that. As a species, we just have never shown a capability to not do any harm at all. Womp womp. So, but one of the things that comes with licensure is like we get updates from the government, from our credentialing boards, from our licensures, right? Like I'm a clinical member for the Wisconsin Association of Marriage and Family Therapists. I'm a clinical member of the American Association of Marriage and Family Therapists. I'm a member of a bunch of different therapy stuff. I get their updates. But as a licensed professional in the state of Wisconsin, I also get healthcare updates from the state. And during something like COVID, during measles outbreaks that have happened in the state, in the case of monkeypox in the state, it's been really helpful to get stuff like that because a lot of times my clients don't have access to that information. And the only reason I have access to that information is because I am licensed. And can I share that information? Can I help clients make informed decisions? Can we talk about facts and data and scientific reporting? Like, yeah, we can do all of that in a way. It's another source of information that helps mental health professionals, medical health professionals make informed decisions. It helps us help our clients. It's really actually a cool thing. And again, I think it's just something a lot of people don't think about. Like, why do I have updates in my inbox about like measles outbreaks? Well, because I'm a healthcare professional, right? On that state level, mental health and physical health aren't differentiated. Again, they are. I'm oversimplifying. But like in that categorization, yeah, that goes out to healthcare providers, which mental health professionals are one of. So I got this email, and I'm a dork, so I read stuff like this. So, of course, yeah, working together to improve the mental health of Wisconsinites. Sign me up, right? They didn't. Nobody asked me. We're going to scroll a little bit. I don't know how this is going to play on YouTube. If you're watching and it makes you dizzy, please take care of yourself and stop watching as I scroll. There's a whole table of contents, introduction. We're going to get into sort of the facts and data, what to do about it. Letter from the council chair. It's all very formal. Thank you to the honorable governor. The things that I want to talk about is why sort of this was made, right? So in the introduction, we need an action plan to address the root causes of Wisconsin's burgeoning mental health crisis. Factual. Mental health crises everywhere, right? Across all demographics, across all age ranges, in other countries as well. This is not a unique to Wisconsin thing. It is good that Wisconsin is trying to address it. Increase awareness, reduce stigma. Great, love it. Doesn't go far enough, but agree and build capacity for us to expand access to mental health services statewide. Again, I'm on board, right? To improve and support the mental health of all Wisconsinites, we must take a whole of government approach in our response. Yes, correct. Then they define what mental health is. And again, like this stuff is bullshit a lot of times and is super fucking tedious. I get that, right? People don't read academic papers because they're exciting. But some of this stuff is really important. And I think it's helpful to understand the framing they're taking on some of this stuff, which is a framing I agree with and I would recommend. Right? They are drawing from the SAMHSA definition of mental health is defined as our emotional, psychological, and social well-being. And I think that gets underlined and circled like 3 times as we're going to move through this action plan. Affecting how we think, feel, and act, and helps determine how we handle stress, relate to others, and make choices. Yeah, that's a good definition of mental health. Again, it has very little to do with our brains, which I think is what people in wider society or cultural zeitgeist is around mental health. Is psychology is in the brain, but mental health is emotional, psychological, and social well-being, which affects how we think, feel, and act. It's not just thinking, it's not just feeling, it's everything. How we handle stress, how we relate to others, and make choices. Wisconsin's mental health crisis reaches all corners of our state and impacts Wisconsinites of all ages and backgrounds. 1 in 5 Wisconsin adults experience mental health illness each year, and 1 in 20 adults has serious thoughts of suicide each year. That's pretty par for the course in our country right now. I don't keep tabs on every piece of data everywhere. I'm neurodivergent in a way where a lot of the stuff that I read sticks. It's not quite photographic memory as other people would understand it, but I have lots of graduate level degrees that I got by reading something once and not ever needing to study or take notes on it because stuff just sort of sticks. I'm not saying my brain's super awesome because sometimes it's not. But when I was asking for funding and working on building a department in higher ed before, during, and after COVID, these were around the numbers that we were seeing. These were some of these numbers that we were on trajectory to see even before COVID. COVID made things worse from a mental health perspective. I mean, 1 million plus people died. Certainly not a good thing. So nationally, 9.2% of adults with any mental illness were uninsured, limiting access to counseling, medication, and other treatment options. Yes, this is a problem. There's a huge problem of not having enough providers as well, which the action plan will get into. In 2023, again, this is where like government's kind of slow. So is psychology as a whole. Again, to do research well and have accurate longitudinal data that's been tracked over a period of time does take time to collect, collate, verify, etc. So we're citing some numbers from a couple of years ago already. In 2023, 921 Wisconsinites died by suicide. For each death by suicide, death from suicide would be better language, I think. As many as 135 other people were affected. For 2023, this means nearly 125,000 neighbors, friends, coworkers, and family members were impacted by a suicide, which, like, again, is a huge number. That's large enough to have a state assembly representative and then some in our state, right? We're talking about huge portions of numbers, right? Milwaukee, which is our largest city, tops out around 700,000 people in the city proper, right? More than that in the surroundings. And as we get into that suburbs, some of that stuff, but like when you drive around the city and see the little population signs, I don't even know if it's 7 still. I think it's like 686,000 or something like that. So that's our largest city in this state. And we're looking at, a big chunk of that is affected by a suicide, right? Just one component of a mental health crisis, right? One final sort of end of the line symptom, not root cause for mental health. So like, this is a huge thing. When you look at 1 in 5 adults has a mental health illness, like that number's too low, first of all. And then like, yeah, that 20%, that affects the other 80% still to a wide range. Like there's very few people who are not affected by mental health. Wisconsin youth continue to report highly concerning levels of anxiety, depression, self-harm, and suicidal thoughts. In 2023, 35% of students reported feeling sad or hopeless almost every day for 2 weeks or more in a row. 19% considered suicide and 9% attempted suicide. Again, those numbers are like horrifically high. We have reacted too late to this. Again, doesn't mean doom and gloom. We shouldn't do anything. Just saying, like, for numbers to be at this point, it's sort of hard to fathom because, again, we're talking about percentages of hundreds of thousands, millions of people, students, right? 18 and under. So, yeah, it's brutal out there, y'all. If you weren't aware there was a mental health crisis, some real sobering numbers here to start off with. Then it gets into how can the government help, which, again, broad strokes was fine and I would agree with. I have some thoughts about the council. uh, One of the reasons stuff like this matters and is helpful is you get a bunch of people who are lifers in the government and they know how to navigate the bureaucracy and get things done. That's a lot of this council. It's interagency. I think it's super lacking in mental health representation. You have a council on mental health problems, and you have a bunch of government agency secretaries, right? Secretary, deputy secretary, executive assistant secretary, assistant deputy secretary, secretary, CEO, executive director, right? Like that's who makes up the council. And like much love in my heart to every secretary I've ever worked with in my entire life. Those are the people who run the show a lot of times. Don't get me wrong. These are not mental health professionals. I did a quick scan of like 4 of the 10 names, and like one of them was trained and has a medical license, but the rest of them are CPAs. They're bureaucrats, and with as much love in my heart as I can muster for a bureaucrat, that's not gonna be the change we need in this mental health crisis. Is what they suggest in this beneficial? Yes. Will it affect people and be helpful? Yes, absolutely. But again, like where does it doesn't dream. It doesn't say, how could we do better? It says, this sucks. How can we make this suck a little less? Without really talking about like needing to change anything, which is what we need. We need to overhaul the way we approach mental health because we need different societal norms in order to be healthy. The way our society is set up is so that people are mentally unwell because capitalism requires that people be unwell. There needs to be a constant level of stress to participate in capitalism because the working class can't be comfortable. So, again, I don't think it dreams big enough. I think it reads like a bunch of bureaucrats wrote it. There are parts of it that I really didn't like that read from people who don't work in mental health. Did they talk to mental health experts? Yes. Did they talk to regular people? Yeah, it talks about like how they went around the state and talked to regular Wisconsinites as well as experts and providers. Again, I'm going to guess that has predominantly been people who participate in state agencies and are somehow connected to what the government is doing. There's not a lot of like, again, overhaul in any of this, which I don't know how much money this is allocated. Again, Evers, our governor, who's a Democrat, has really been fighting an uphill battle against the Republican-controlled legislature. He came in after Scott Walker really gerrymandered the state to hell and did a bunch of what should have been illegal stuff in a lame duck session to really hamper Tony Evers. Again, when Wisconsin gets to vote democratically, we are Democrat. Like we lean left. Wisconsin has a long history with the Socialist Party. We're one of the first socialist mayors here in Milwaukee. So again, like this idea that Wisconsin is purple is only because, again, we're not a democratic country. But so again, like I'm scrolling down for the people who can see it. Wisconsin Department of Health Services, Department of Administration, Department of Agriculture, Trade, and Consumer Protection, Department for Corrections, DSPS, that's the licensing agency. That's probably the only one that has anything to do with mental health. I get that corrections and the VA offer a lot of mental health services to those people. But again, like that's not necessarily that the secretary who's representing them on this council has any mental health training. Military affairs, Wisconsin Department of Children and Families, the Veterans Affairs, Workforce Development. Like, again, it's for being about mental health, it's like just a bunch of government agencies. I won't say somewhat thrown together, but like nothing in there screams mental health at me. Even DSPS, they license MMA gyms, they license barbers, they license a bunch of people who have nothing to do with mental health. It's just the licensing institution in the state that oversee all licenses. So yeah, I think swing and a miss on who was included. Well, that's the government for you. I don't know why I did that in the Southern drawl. That's the government for you. Subject matter experts from each council agency supported 2 focus areas of the council's work: prevention and services to support a strong foundation for mental wellness, and appropriate care and treatment to ensure coordinated response to mental illness. Again, in theory, this is all great, right? What does the strong foundation look like? Let's scroll down a bit and look at that. Strong Foundation Work Group. The vision is improving the mental health of our state will require us to improve our environments, policies, and systems, which ultimately affect people's mental health and quality of life. Yes, mental health is directly tied to quality of life. If quality of life is low, mental health is going to be low, right? It's not even about mental illness at that point. It's just on quality of life. Yeah, that needs to be better. That's environments, policies, and systems. 100% agree. Focus: housing, food access, childcare, healthy relationships, financial stability, social connectedness, social and emotional learning, and other priorities identified. Hell to the yes, right? None of that is therapy, right? Why so many therapists are burnt out and why so many people are struggling right now is because it is correct for your brain to look around at the world and go, yo, what the fuck? That's the correct response. To have a stress response to a stressful situation is correct. Your brain's working correctly. That's not mental illness, right? We shouldn't have an entire generation of millennials who are burnt out. We shouldn't have an entire generation of Gen Z who's apathetic to the workforce because it seems to suck, which is, again, correct. Why should they participate in organized civilization when organized civilization has nothing to offer them but wage labor, right? Why work really hard for most of your life just to make some rich asshole more money? Sounds like a bad deal, because it is. That's your brain working correctly. So in order to improve mental health, we do need housing, right? Maslow's hierarchy of needs is overly simplistic and been a little bit, I wouldn't say it's been disproven. It's been proven to be woefully overly simplistic. But for a wide general audience here, you're maybe familiar with Maslow's hierarchy of needs, right? What we need to be functional: food, water, shelter, first and foremost, right? And rest. We need to sleep. Our brains need it, or we die. We will die from lack of sleep. That's a real thing. So we need housing, shelter. We need that. Also safety, place to rest. Food access. Yeah, we got to eat to live. And ideally we could eat healthy. That'd be cool. Childcare. Yes, if we're going to take care of the future and have a civilization in the future, we need to have childcare. Healthy relationships. What does that look? What does that mean? Well, again, I think it's talking about social connectedness here. That's a separate topic that it gets. But healthy relationships, right? With family members, with our neighbors, with the things that provide meaning in our life. Yeah, I think that's great. Financial stability. To a degree, yes. Again, like, that's a social construct that, like, you would have financial instability, right? Like, this is where it's like, well, yeah, financial stability does decrease stress. Like, the idea that, like, money doesn't buy happiness is provably false. There's a certain level at which money won't buy more happiness. But again, if you're like a millennial, there's not a single issue you're dealing with in your life that money wouldn't improve. I wouldn't say not a single, because again, I'm a relationship therapist, and a lot of what people are dealing with in their relationships is poor decisions that they themselves have made. Social connectedness. Yeah, like, again, I don't think I read this whole document start to finish, which is, I'm a skimmer, so I was really actually taking my time. I don't think third spaces come up at all, but it's a thing I talk about a ton. It's one of the reasons I am deeply critical of the sex pest ring of criminals that is organized religion that gets a tax break and other things don't. We need third spaces that aren't tied to religion. And religion isn't using those third spaces because religion keeps losing money. So they're just trying to participate in both capitalism and politics. So they really shouldn't be tax exempt. But we need more third spaces. This is a conversation I have with clients on the regular. Where do they go to meet people? How do they connect? When we talk about building community, what does that actually look like? How can they do that if they don't have extra funds? I don't know. Again, all my diplomas on the wall didn't teach me how to deal with late stage capitalism and empire crumbling. So yeah, all this stuff is really great. Theory, I'm aboard. Implementation, let's see. The coordinated response work group's vision was when a person or loved one needs help, they get the care they need, no matter their mental health symptoms or which door they come through. Focus of a no wrong door approach, a sustainable workforce. A no wrong door approach is it doesn't really matter where somebody goes to seek help, that they will get directed to and helped to get to the correct place. So anyone asking for help is going to get the help that they need. Love that in theory. No wrong door approach, a sustainable workforce, eye roll, but whatever. Data-driven responses. Again, like the government providing for life, liberty, pursuit of happiness, not financial gain, not financial stability, like life, liberty, pursuit of happiness. It doesn't have to be workforce. Data-driven responses, that could mean a lot of different things to a lot of different people. Again, like if you talk to Sam Altman or Elon Musk, they're going to talk about AI. If you talk to me, I'm going to say peer-reviewed empirical data. So I don't know what they mean by data-driven responses, but it sounds nice if they mean it correctly. And trauma-informed care in healthcare facilities, correctional facilities, community-based organizations, and workplaces, including state offices and other places people access services. Yeah, we need more trauma-informed folks, trauma-sensitive work for sure across all those institutions. Then we have a picture of a bunch of white people and a few non-whites. It's Wisconsin, but again, like Milwaukee and Madison are diverse. The rest of the state is not. So I'm not going to make a big deal about that. Where are we for time? We're 26 minutes in. Listener attentively listening. The root causes of mental health in Wisconsin, of the mental health crisis. Even those who are never diagnosed with a mental health condition can struggle with challenges that impact their mental well-being. Additionally, some Wisconsinites are more susceptible to experiencing mental health challenges based on their situational circumstances and environmental factors, like letting Menards pollute our rivers and Great Lakes. Wisconsinites impacted by mental health are identified below, along with state and national trends that demonstrate the challenges people are facing. Students' feelings of belonging in their schools decreased from 74% in 2013 to 54% in 2023. It's a big drop. 59% of high school students report experiencing at least one mental health challenge within the past year. Teen girls have reported high levels of violence, depression, self-harm, and suicide risk. Gosh, maybe we should not have a president who's a pedophile and maybe not have a pope who's spent his whole career defending priests who molested children. Right? Like, why are women suffering from so much violence? Because we keep promoting men who are violent. I've never worked with a cop who wasn't abusing his spouse. That's anecdotal, right? That's not every situation ever. But like, again, mental health career of 17 years. It's not nothing. Nearly 9% of Wisconsin's youth have attempted suicide and 90% have seriously considered suicide. That is such a bummer. Children ages 0 to 5, 68% of Wisconsin doctors do not ask about parental concerns with learning, development, or behavioral problems. 90% of brain development occurs between ages 0 to 5. Experts advise that mental health care be embedded early into routine care. Mental health care, not just for the children, but also the parents, right? We're in the middle of like perimental mental health awareness week. It's bad. The reason moms and dads, 1 in 5 moms, I think this is, again, data I saw recently that is just going from memory. 1 in 5 moms will have symptoms, postpartum symptoms. 1 in 10 dads will have postpartum symptoms. So like, that's, again, appalling numbers in a supposedly first world country that has the worst mortality rate, both for babies and for mothers. Like we're failing. We're failing. Mental health conditions are the leading point that I was making. Mental health conditions are a leading cause of pregnancy-related death in Wisconsin. In 2020, 38% of pregnancy-related deaths were due to mental health conditions, including overdose. 41% of parents nationally said that most days are so stressed they cannot function. That's not because of mental health problems. That's because civilization isn't supporting human existence. Parents and caregivers face stressors such as financial strain, ding, 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 time demands, concerns over children's health and safety, isolation and loneliness, and difficulty managing technology and social media. Again, that difficulty managing social media is because like everything sucks and what's available to us is our phones. We're supposed to go meet friends. We don't have any money. Everything costs something. We don't own things anymore. Everything is a subscription model, right? We're focused on like the loneliness epidemic and not like financial strain. Again, I don't think universal basic income comes up at all either in this, which like are such easy layups that are backed by so much research. It's maddening to read something like this. And this is where like I have some complaints about this. We're half an hour in. We're getting to my complaints, he said, somewhat sarcastically. People who live in rural areas are struggling. Workforce shortages are more challenging in rural areas, as fewer providers means people may have longer wait times or must travel further to see a provider sooner. Yeah. 66 of Wisconsin's 72 counties contain a mental health professional shortage area. Again, that includes the urban areas. We're a poorly resourced state. Every therapist I know asks every other therapist I know if they know of any psychiatrists who are taking new clients. All of us are looking for NPs who have mental health training who can prescribe, because that's the best way that our clients can get both good level of care with somebody who actually like spends time and talks to them and actually listens to them. And there's, not enough of them. 28% of counties had no practicing psychiatrists, and 76% faced significant shortage to find as fewer than one psychiatrist for every 10,000 residents. And again, that's such a stupid number. When I worked in higher ed, I worked with all the student athletes, not every single one of them, but like I oversaw the student athletes, which is 800, right? One provider for 800 is not enough. So a shortage defined as fewer than one psychiatrist for every 10,000 residents. How is one psychiatrist going to see 10,000 people? It simply cannot be, right? It's a preposterous statistic. So like, again, 100% are facing a shortage if we used actual good parameters for our data. Most rural adults agree that availability, embarrassment, 55% said availability, 52% said availability, and stigma said 51% would be a barrier if they were seeking help for mental health conditions. Again, I don't know. I don't have a lot of sympathy on embarrassment and stigma. Grow the fuck up. Like, asking for help doesn't make you a bad person. I have little tolerance for being like, shucks, the people in the rural areas need more help. Like, if we put more help out there and like, I don't know, Ma and Pa out in Ripon, Wisconsin, who are like, going to therapy might make you woke or gay or something. Like, no, fuck that. Like, I don't have sympathy for that. Availability is a problem. Farmers and farm workers are most likely to say financial issues, 80%, weather or other factors beyond their control, 82%, in the state of the farm economy, 80% impact farmers' mental health. Sure. Yeah. But also, like, we need to revamp farming completely because we keep growing crops that have no nutritional value, and we're depleting the land of any of its natural resources because we are existing under capitalism. Mental health can't fix capitalism. People who have served our nation, veterans. Wisconsin has approximately 331,000 veterans. In 2022, 145 veterans died by suicide. Veterans make up 6.2% of Wisconsin's adult population, yet they account for 16.2% of adult suicide deaths. Again, that's appalling and also happening across the nation. Point in time national data shows on a single night in January 2023, there were 35,000 plus veterans who experienced homelessness in the United States. This reflects a 7.4% increase in 7.4% increase in the number of veterans experiencing homelessness from 2022. That's your Republican legislature again, like gutting the VA, gutting services like this for no good reason. Again, like imperial tendencies and sending people to war for profit of oil barons is a bad idea, but like certainly abandoning them when they have seen horrific things under the propaganda of being for our country is disgusting. and should be criminal. Depending on the branch, not for the service members, for the politicians who are not supporting those people who they asked to do more than they themselves were willing to do. Depending on the branch, up to 31% of service members develop post-traumatic stress disorder after returning from combat. And again, I'm going to say that number's low because not enough people are trained to identify trauma, and they're just talking about, like, I'm going to say the DSM-4 version of how trauma was defined. And that's bad because the DSM-5 version of how we talk about PTSD is bad because we don't even include complex PTSD yet. So that number's incredibly low. Also, yeah, it's whatever. Yes, we need services for that badly. And that's, again, like, gets back to like housing. Housing is a solvable problem. Immediately charge stupid high taxes on people who own more than one property and get veterans housed. We have enough houses to house people. It's not a mystery. Get private equity out of home ownership. People who work in behavioral health and public service. Yeah, we all have trauma, secondary trauma. We're overworked, under-resourced. There aren't resources to refer people to. So we end up taking on more than we could hold. La-di-da-di-da. I'm not dismissing that. I'm just not going to spend a ton of time on that. Wisconsin state employees are eligible for mental health programs, which provide peer and professional supports. However, these have low utilization rates, 1% to 2% of eligible employees. Again, like, that's where they start getting into like stigma stuff. Like, that's a poor idea, right? Because it's going to be during work hours and it's going to be telehealth. Like, that's not community building. It just isn't. That's not peer support as we would need it. People in crisis. Yes. Again, I would say we're in a better spot than some states because, again, thanks to a few key Democrats in the state leadership, we're actually still funding crisis lines, which federal funding got cut. And like, those are a last line of defense sort of safety net. Those are not preventative. Those are not awesome or flawless all of the time. So again, we're like better than other states, but it's still bad. Talks about drug use a little bit. It doesn't include alcohol in that because, again, then you would have to say that, like, maybe the Tavern League of Wisconsin shouldn't be the thing that controls a ton of policy and decisions. People involved in the correctional system. Again, we just should not have a carceral system. That would solve a lot. That's certainly not what they're going to say. In Wisconsin, nearly half, 46% of adults who are incarcerated have a diagnosable mental illness. 18 of the 20 adult correctional institutions that provide mental health care in Wisconsin have designations as health professional shortage areas. Within the Department of Corrections, Psychological Services, staff vacancies currently set at 18%, social service at 21%, and youth counselors at 8%. It's nice that youth counselors is the lowest percentage. Again, nearly 10% of youth counselor positions are vacant. That's a problem. Approximately 32% of correctional officers reported mild to severe depressive symptoms, and 37% reported mild to severe anxiety. Yeah, don't work for the carceral system. It's bad for your mental health. People with unmet needs, unhoused population is increasing still now. Wisconsinites struggle with social isolation and inadequate social connections because everything's too fucking expensive. This episode is not good for my mental health. 11% of households in Wisconsin live below the federal poverty line, and that number is a joke. And another 23% of Wisconsin households earn more than this, but cannot afford basic household necessities. You would think that gives away the game that the federal poverty line is a silly number, right? It's like what you need to do to not die is the poverty line, as opposed to like meet basic household needs, which you would think would be the actual poverty line. It's a whole thing. I'm not going to get into it. The actual poverty line in modern times would be something like a household earning like $132,000 or something like that, which again is why we have a generation of people, and everyone under those people, millennials, who are living paycheck to paycheck and pretty much have been their entire working careers, because there is no social climbing anymore. More than 8% of Wisconsinites did not receive needed medical care in the past 12 months because of the cost. This proportion is higher, up to 19.3% for non-white Wisconsinites. I'm just going to say tack on another like 25 to 30% to those numbers because those are incredibly low. People don't go to the hospital because they don't know how much it'll cost. They don't ride in an ambulance because they don't know how much it will cost. Again, the idea that healthcare is for profit is like terrible. In 2023, an estimated 3,197 Wisconsin deaths were attributed to alcohol, in addition to lives lost. They talk about binge drinking cost $400 billion a year. Sorry, $4 billion a year, which is approximately 700 per Wisconsin resident. And again, I don't care that productivity is lost, which is where a lot of that number is coming from. But like, yeah, we have a problem with drinking here. We're kind of proud of it. That's a cultural thing. Okay, root causes. Let's scroll and see if it says capitalism. Ugh, it doesn't say capitalism anywhere. Yikes. We maybe are missing something important if we're not willing to talk about this system that overarches everything here. Root causes of mental health crisis in Wisconsin. Understanding the factors that contribute to our mental health crisis is a key step in identifying solutions. I love that. Lack of integrated systems. Yes, because of capitalism. Right? Because we could just have single payer healthcare, quote unquote socialism, and that would integrate the systems. Bing, bang, boom. We did it. Go home, everyone. Access to care. We could have single payer healthcare, and that would improve access to care for everyone. Stigma would not be solved by that I'm aware of by single payer healthcare. But I think again, there's a huge generational shift in the stigma around mental health. When you're talking about old people and millennials and younger, that shift is insane. The 26-year-olds who come into my office know a ton about mental health and have no qualms about asking for mental health care. The kids aren't all right because of policy choices, but the kids are all right in the way they care about themselves and each other. Awareness. Again, there's a big generational gap. I do agree with Wisconsinites may not know where to go for help. Again, if you're talking rurally, but I wouldn't say in the urban setting. How much it will cost. It's ding, 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 ding. Let's just like circle that 65 more times and say, we could have single payer healthcare where you go to any care, physical care, healthcare, PT, dentist, eye doctor, whatever, and not have to worry about that or how they'll pay for it. Right. Like, yeah, because insurance is a scam. Mental health symptoms like body aches, inability to concentrate, inability to get out of bed, loss of appetite, losing interest in hobbies, and trouble sleeping can go unaddressed. Sounds a lot like depression to me, or PTSD, or any other number of things, or just like burnout from living in a capitalist dystopia. People are uncertain if seeking help will negatively impact their jobs or other aspects of their lives and livelihood. Again, because the capitalist ruling class are douchebags who only exist to extract wealth from other people. If your boss is going to fire you because of a mental health problem, your boss shouldn't get to own a company. Ta-da! Stress. I do agree with stress. Again, financial strain is probably big stress for everyone. Farmer must contend with unpredictable weather and the market prices. Man, what's up with the weather? Right? That's a weird one. Oh, could it be climate change because of capitalism? It's really maddening to read stuff like this when it's like, hey, other countries have figured some of this stuff out and are doing a lot better. Again, I said earlier, mental health crisis across demographics, across different countries. I wouldn't say anybody's solved mental health. And climate change, other countries have adopted at least hopeful programs. So, instead of farmers being like, I don't know where to go because I live in the middle of nowhere and take a bunch of government money and then vote against my own good interest, we could have green energy would be cool. And sustainable farming practices instead of for-profit farming practices. What else would be cool? We could have food. We could have universal basic income. There, that's all. Solved it. Affordable childcare. Solved that too. Transportation. That would take longer to solve, but again, public transportation would be lovely to have. everybody experiences adversities due to institutional discrimination. Yeah. People of all backgrounds, ages, races, ethnicities, genders, and sexual orientations. Yeah. None of it's good. Social connection. Yeah, that's a problem. Lack of investment in early intervention and prevention. Again, because people like the Republicans in the state legislature vote against social emotional learning. Again, stuff that's backed by a ton of research. But like, let's argue about getting the 10 Commandments put in classrooms because kindergartners should know what adultery is. Idiots. And funding is a problem, which is true. I won't disagree with that. Again, like, I want the government to provide space for people to live their lives. And if somebody needs a certain level of care, like, yeah, the government should fund that. I'll pay my taxes so the government can fund that. I don't want to pay taxes that go to ballrooms or blowing up brown people or incarcerating brown people. This is less tax goes to that now because we're just letting private equity take over prisons, because actually if you turn people into a commodity, you can make lots of money off of them, turns out. Really cool civilization we've got here. Here's where people were included. Regular people were included. Meeting basic needs. Folks don't have access to housing. You can tell this is a regular person because they said, if folks don't have access to housing, water, food, sleep, safety. Like, you could just have Charlie Berens read this. Manitowoc Minute. They're not going to have any mental wellness. Housing, water, food, sleep, safety. Time off from work. Basic needs accounted for. Focus on activities that build community. We would need space to do that and free time to do that. How about 6-hour work days and a 4-day work week and universal basic income, and have fucking Menards pay their taxes? If you're like, Jeremy, why are you so anti-Menards? It's because the Menards family is the largest polluter of the state for like the past 2 decades. Don't quote me on that. This is an approximation, allegedly. And again, they just keep doing it because the fines are so small that it's worth it for their profit margin. Fuck shareholders and the capitalist ruling class. Focus on activities that build community. People are becoming more isolated from genuine human interaction all the time, and people need support in real time. Yeah, I'm old enough to be like, a lot of the places I used to play volleyball have shut down. Bar league softball did not come back after COVID the way that it was before COVID. Because a lot of these things are not run by like the rec department. Some of them are. Shout out to your local rec department. Check out what they're offering. But there's a price associated with that. Again, it's not free. It could be, it should be, but it's not. And losing space, right? Not having space to do some of this stuff. Having wellness be for profit, having health be for profit. I'm literally holding my head. It's like, it's so stupid, it hurts. And then there's not a coordinated response. We have to meet people where they're at, and when they're dealing with mental health, we're dealing with the whole person. Try not to make it so difficult. One person said, things are hard enough. Forms, processes are challenging. State agencies should provide more collaboration and streamline resources and processes to make things less confusing and make them easier for those who are seeking help. 100% agree. It's a difficult and daunting system to navigate while in mental health crisis from a patient's perspective. Yes. Yeah. And again, when you sell everything to a company like Epic, when Freighter and Aurora and whoever else is in the area won't talk to each other, and like, right, everybody's tracking all of our data. We have no privacy anymore, and none of that gets used to our personal benefit. Everybody, again, is just extracting wealth off of us. So yes, there need to be more integrated systems. I'll say it again. I don't know what that does to my microphone. It might have sounded terrible. I'll say it again. Single payer health care would solve that. An integrated system? What if there's just one? There's just one system. Wouldn't that be integrated? Oh, what a mystery. And that this council couldn't figure that one out. Dorks. I won't be like capitalist bootlickers because, I don't know any of these people, but This is also why I'm like not fun to have at parties. And I listen to Igor. I don't know. There's more than one reason I'm not fun to have at parties. Once a person, okay, yeah, we need more integrated systems. Yes, access to care and basic needs not being met. Yeah, and again, the solution is we'll try and be better about those things. You shouldn't have to wait months to see a provider. Could add to the suicide rate. It just shouldn't be so hard to ask for help. If you have a broken arm, you go to the doctor and it's fixed. Which again, like, nah, not in America. We don't get an ambulance because we don't know how much it's going to cost. If you have a mental health crisis, you can't even just go to the doctor. Yeah, correct. Also correct for doctors. You wouldn't believe how long it's taken me to get like temporary prisms put on my glasses because I'm old and have vision problems now. Our opportunities to ensure affordable, accessible, and timely care. Wisconsin agencies can work together by prioritizing access to care and integrated systems. You see, we're not addressing the affordability problem. They will in access to care, but the action plan. Hooray. And like Evers is up. He can't run for governor anymore. So we do need to elect a new governor, and let's make sure it's a Democrat, and let's vote for the one that's furthest on the left. Again, like this is where it gets into like a lot of here's what we can do now without a lot of like, yeah, but how? Like, again, Evers has done a bang up job with like we're the one state in the area that doesn't have weed legal, so we're missing a ton of tax income from that. Because that'd be cool. Instead of everybody driving to Illinois or Minnesota or Michigan, depending on where you're at. Focus on prevention, integrate systems, decrease stigma, and increase awareness. Again, like we have funding, like balanced budget surplus, even in some instances where like we can move some money around for this stuff, but we're not having the conversation about like taxing the rich and redistributing that wealth so that things are affordable. Streamline service access, develop an integrated state platform. Again, like if private equity firms aren't going to play nice, then it doesn't matter what the state does, right? Like, again, the state could say it's illegal to do this here for profit, and that's not part of the solution. So like there is an easy, obvious way to integrate systems, and they're not having that conversation. Help state agencies and partners promote mental health and wellness. Again, like having the little like take care of yourself at the end of an email sign off is great, and on social media is great. It might help someone, but like have a 4-day work week would be something the state could do, at least for state employees. So no, like we're not do that. Promote mental health and wellness resources, but not do that ourselves. I don't know. It like again, it's just like create resources to explain insurance to people is helpful, or just be like make it illegal for insurers to use weird fucking language. Make it illegal for an insurance company to make more than $1 million in profit. Guess what? None of the insurance companies could be here then. Tax them, or go single payer would be better, and then tax rich people. Increase focus on prevention. Again, yeah, 100%. Start young, get it earlier in the schools, yada, yada, yada. We've done a lot of that. Again, like the young people, the way that they approach mental health, the way they take care of themselves, the way they advocate for their mental health is a lot better than it used to be. I do think we need to work on some distress tolerance. Maybe that's just, again, skewed by who I see in therapy. And I'm married to a teacher, and I have 2 kids who are school-aged. So, you know, societally, like, yeah, we need to have a more excuse me, gotta take a sip of my medicinal caffeine drink. We do need more collectivist ideology on like, again, taking care of more people instead of being so individual. I don't expect the state to solve that, but provide trusted, accurate, and accessible prevention resources. Again, for as much as we have done to make Narcan available, to have resources available to people, all that stuff is great return on investment. Doing some of this stuff at the state level, making sure kids have lunches at school, have breakfast at school. These are great things that Wisconsin continues to do, even if the federal government tries to cut money to it. It's why you vote for Democrats. And again, like, yeah, reduce stigma, but there's not an action plan on that. Like, acknowledge mental health. Like, we've done the awareness months for how long, and like, we're still talking about stigma. So maybe something more than that. Maybe like action, have sensory friendly rooms, have sensory friendly corners in every room, right? Like, make sure everything's wheelchair accessible. Make sure we don't have lead on the walls or in the drinking water, right? Which was the thing we were doing. And then RFK Jr. interrupted it and cut the funding to it. So make America have lead poisoning again. Support employee mental health. Again, this is where I'm like, yeah, you're missing the mark entirely to be like, wow, we should let our state employees know more about our EAP, which covers 3 therapy sessions, because that should solve everything. Like, you're not doing it, state government. Bureaucrats who have been in the bureaucracy for more than 25 years, you're not doing it. How are you helping other people do it? It drives me batty. I'm scrolling kind of fast. I just know this is turning into a long episode. Improve mental health services through continued mental health focused conversations with partners, provide clear next steps, and follow up on how those conversations will influence practice. I mean, again, it's a financial thing. I don't think it's lack of awareness per se. I think people don't go to therapy, don't go to mental health things because they don't know how much it'll cost, right? Collaborate with county mental health programs and schools to identify at-risk youth. And do what with them? Because again, it talks about Department of Workforce Development and Vocational Rehabilitation, like, get them to participate in society, make them better capitalists. Like, no. Offer them something that isn't a broken civilization, right? Like, that's where it's just like, oh, we identified an actual problem and our solution is more of the thing that caused the problem. That's not going to work. I feel like I'm shouting a lot this episode because I care about my state as much as I'm like, borders are made up and stupid. In-group, out-group dynamics work on all of us, even when we're somebody who calls in-group, out-group dynamics out all the time. Explore coverage for peer specialists, community health workers, and other workforce care extenders within the state's health plan, state employee assistance program. Wanking motion, get rid of the state EAP. It doesn't matter. It doesn't help. And again, I will say for mental health, it might help for going to PT or perinatal mental health or PT or whatever. Like, if that is great for other things, then expand it to be better for mental health, because it's not good right now. But yeah, we need more community partners. We need doulas. We need death doulas and birth doulas. We need a lot more people who can do this. We need mental health first aid responders. We need mental health crisis responders. We need people who don't need to be fully licensed, credentialed therapists or psychologists or psychiatrists or prescribers to be able to respond to stuff. But that requires community engagement, and that requires space to commune and free time to commune, which requires capitalism to be dismantled. Engage with insurance carriers and encourage them to build networks, which include providers with expertise in serving specific populations, such as farmers, veterans, refugees. Cool. Or like, sue the insurance agencies and redistribute that wealth for their shitty practices to decline coverage to people. Because again, a lot of the stigma is because insurance companies will deny coverage for pre-existing conditions. Make insurance providers illegal. Continue support for the 998 crisis and suicide lifeline. Yeah, 100%. Again, that isn't accessible everywhere. Trump cut that. He wants people to die because he's not a good person. He hates poor people. So, good for Wisconsin for keeping that stuff going. That stuff really matters. It truly saves lives. What we can do moving forward. Action plan. Increase access to care, preserve quality and reduce barriers, licensing and telehealth. Telehealth isn't the fucking solution to it. Pardon my French. It's like the 18th time I've sworn this episode. Right? Telehealth is a nice addendum to a robust community response. Right? I have clients who can't always get into my office, and hey, My kid's homesick with the flu. Can we do telehealth today? Yeah, absolutely. Right. I have some clients who see me for religious trauma and they're telehealth exclusively because there are no religious trauma providers where they are. Right. There's nobody with that expertise or that specialty. I get that. Right. But by and large, like having time to not be at work, having time to go down the road, across town, whatever, and see somebody in person, go to a support group. If you want to build a peer-to-peer model, there needs to be time and space for that. It's not telehealth. Not telehealth. Focus on social connection, not telehealth. Right? Like, again, their own goals and processes are not playing well together. Help those in transition, offer incentives. Sure. Continue our work, state funding, sustain programs and services, support funding opportunities, create payment parity. Yes, all that stuff is needed. Again, I think increasing awareness of specialized populations and assist agencies in understanding the value of those things is great. Revise administrative rules, state policies, and other published materials to encourage access. Yes. Coordinate among agencies. Yes. Again, a lot of times when bureaucracy is like, we need to streamline, they end up adding more bureaucracy on the back end or like the client facing part instead of on the state's part. So revamp that whole fucking process because, right, like something like applying for disability is a nightmare. And I tell everybody who does it, you're going to get declined the first time, no matter what. Like the system's so broken. It's a 9 to 18 month wait list for most psychiatrists. The system's broken. Partner with licensing entities and telehealth platforms. No, fuck no. Telehealth platforms are already selling people's data. They're tracking data. It's being used to train AI. It's not kept confidential. It's being given up in court cases when it should be confidential. Like, no, that's not the solution. To broaden access to services in rural areas for specialized populations, even culturally competent care. I'd love to live up north. That's a lie. I'm a city slicker through and through. There's a part of me that would be very comfortable being up north. I know providers in rural areas, right? It's not that they're not there. It's that people don't have money, right? And can't take off time from work to go see the providers. Yes, we need more providers. Again, I said every county is a shortage. Like, yes, we need more providers, but we need less red tape for people getting licensed and less red tape and less expense for people to live where they want. It's expensive. It's expensive to have to drive into town. It's expensive to have to use shitty Spectrum or, if you're further up north, charter internet services that may or may not work when you're trying to provide telehealth. Like, state that stuff the government should do, right? Expand peer-to-peer services, such as for veterans and tribal nation members. Yes, I agree. Time and space. Medicaid reimbursements. Again, like if we're going single payer, Medicaid's going to be part of that, or we'll rename it something else. But like the system as is needs to be like deeply reformed, if not outright revolutionized. But increasing coverage for peer specialists, again, within reason. I have some qualms about that, but like, yeah, there's a huge shortage. I would rather have somebody see a peer specialist than like suffer needlessly or at worst die from something that was preventable. So like, yes, that's not going to solve the gap though. Don't coordinate with telehealth partners. That's not the fucking solution. Those are for-profit institutions that are all owned by venture capital on the back ends and do not care about health outcomes. Pursue interstate compacts so that providers can work across state borders. Again, that's better than not, right? Like that's been good. That's been good for SciPact already exists. It's a lot of providers. It's unwieldy, but not impossible for providers like me who are LMFT to, we can't get into SciPact yet, again, for no good reason. Bureaucrats being bureaucratic. But like I could get licensed in other places. I just choose not to because like my caseload is busy and I don't need more people from other states. If I were to try and like focus down on just one of my specialties, then maybe. But again, I like meeting with people in person. It has a huge benefit to not just the work that I do with people, but also to their mental health, like setting aside time for therapy, um, setting aside time for yourself, whether it's a spa or therapy or a workout or a nice meal, is good for your mental health. So, um, enact policies that address social disconnection, like sort of. That's not really what I want the state to provide. I want the state to provide space, basic necessities being covered, and space, right? Like when you look at other countries, they have community centers that are funded by the state, right? They have transportation that's funded by the state. They have maternal leave and sick days and vacation days funded by the state. That's what we need. The social disconnection will drop when we have all that other stuff. Yeah, proactively offer and continue mental health services for those in transition, such as military to civilian, corrections to community, new Medicaid members, new parents, new state employees, etc. Again, like, yes, Milwaukee has really good perinatal mental health coverage, actually. Like, we're deeply resourced. Probably not at like the state provider level, but there's a lot of people in the area. Mom's Mental Health Initiative is here. Milwaukee Diaper Mission is here. Tons of individual providers that I know specialize in perinatal mental health. It's great. Medicaid members is going to be a huge thing because, again, the old population is getting older and the people who are going to be converting on Medicaid, and then like Republicans keep trying to defund it. So it's going to be a problem when the homelessness problem increases with a bunch of old people who are not getting the services they need. So that's a problem. Incentivize managed care organizations and providers to improve services and mental health outcomes. Yeah, take their money. Yeah, every insurance agency, I don't work with insurance anymore because they're such a fucking pain and get in the way of providing good care. But even still, like, even just giving people super bills and having people pay their out-of-network benefits, like insurance companies try and fight that constantly. Like, it's just a scam. So working on, and then again, there's some good stuff, like not just continue to fund, but increase funding for the suicide hotline and crisis lifeline, children's mental health, and mental health services, including in school, peer recovery centers. Again, like we should legalize weed and a bunch of other drugs because alcohol is legal. And we already have designated safe use spaces. They're called bars. They're on every corner. We should have that for other stuff too. The idea that, like, we talk about veteran coverage, but like Wisconsin Madison is UWM. UW-Madison is like one of the largest researchers on psychedelics, and we're not like legalizing weed, let alone psychedelics here. Is madness. Wisconsin Department of Health Services, care and treatment facilities. Yes. Clinician wellness program. Yeah, implementation would be slow and low on that. We don't necessarily need more wellness programs. We need more time off and to not feel like we have to work all the time. Medicaid reimbursements for mental health. Yes, Medicaid is notoriously bad at reimbursing, so it's a problem. Farmer mental health assistance program, veteran recovery programs. Like, again, I'm not like opposed to people who live out in the sticks. I'm not anti-rural. I'm not anti-farmer. Just like, I hate how little about this is like the inherent system of capitalism, the institution that has been ruining this stuff for decades that we've been tracking and noting, and now being like, oh no, it's a crisis. Where did this come from? And then not addressing where it came from. It seems disingenuous because we're not trying to change that. So how much better outcomes do we really actually want? We should, provide grant funding to county sheriff department and local police departments to develop and support co-responder models, or like, take a bunch of the money from the cops that they use on military grade equipment to kill people with and like put that towards mental health. Pay for social workers, pay for people to be trained to become social workers. Yeah, we could demilitarize our police force and have mental health care be paid for that way. That'd be cool. That'd probably cover a lot. You'd probably do like maternal leave and stuff too. Maternity leave and paternity, right? Both. Increase access to state, federal, and other funds. Federal funding is getting cut for mental health everywhere. Like, again, sort of state gonna have to do this. It's gonna be blue state versus red state at some point. Create parity in payment. Yeah, again, like I get paid a lot less than a PhD or a PsyD, even though the amount of schooling I've been in is the same, sometimes more, because I've done my postgrad too. So I don't know. That's stupid. A lot of people I know who have their PhDs are not good providers. So I don't have a solution to that. I don't necessarily require the state to do that. Like, again, that's an education problem, probably. Yeah. So, and like, then they have like building on our success. Again, I think Evers has done a good job in a bad instance. 988 and Crisis Lifeline, it says receive over 10,000 calls, texts, and chats per month. Like, yeah, that's a good thing to fund then, right? 50 million, 30 million secured to continue providing school-based mental health services. Love that. That number should be higher. We should pay teachers more, but like Evers has been pretty good about that too. Again, pretty good in the like broken America system, not like what data and other countries could do. So yeah, there's some stuff that is good. Evers is a former educator. He's a teacher. He worked in schools for a long time. So he's got a good, he's had a good approach on that. We need to do a better job for Indigenous folks. We need to do a better job for BIPOC people. We need to do a better job for mothers, for sure. We don't need innovation, right? Like state agencies have also been working on innovative solutions and cross-agency partnerships. Just divest from capitalist structures and tax the wealthy. You pay for it. We don't need to reinvent the wheel. 32 out of 33 other countries that are ranked above us who have similar amount of wealth as we do have figured this shit out. Other countries don't struggle with the unhoused population. Everyone's housed, and people who aren't housed, who have active mental health crises, have access to services. So, I don't know. Jerking ourselves off when we've just said there's a huge crisis doesn't necessarily feel particularly relevant. But conclusion, Wisconsin mental health crisis is complex because to solve it, we would need to divest from capitalism, and we're unwilling to do that is the complexity there. This is why I wasn't invited to speak, right? I'm not unaware. A 30-page document that's taken me an hour and 10 minutes to dissect. There's no single all-encompassing approach to solve the challenges Wisconsinites are facing. That's true, but there's one really good one that they chose not to talk about. While state government is in a role to facilitate programs and services to help people to truly address Wisconsin's mental health crisis, it will take everyone's collective. Yeah, we should be more collectivist, like making rich people pay taxes and redistributing wealth. Step up to the challenge. So, I don't know. It's not bad. Again, for as much as I'm complaining about it, I will say it could be worse. It could be something like RFK Jr. and Maha put out, but it's not good. It's stemming the tide. It's oh man, I just pulled my own screen up and I got some lag. Hopefully that's not coming through on the audio. It's fine. Again, I think it's sort of a like it is what it is while the empire collapses, like making the best of a bad situation in the American institution that has a for-profit model for healthcare. Like, yeah, that's never going to work. So it'd be worse to say we're cutting all of these things to pay for, I don't know, a governor's ballroom, for example. So it's good that we're trying to fund things that are good and helpful, but this isn't revolutionary. It's we're going to bail out the water in the sinking ship, but we're not going to stop this ship from sinking. We're just going to slow the sink and hope a future generation figures it out. I don't know. I knew this wouldn't be a hopeful episode, but I again, there's things that are good. We could be an actual red state and not have a Democratic governor who's done a lot of good stuff. It's just hard when you're like evidence-based and have a research background to not use your brain and say like, there's actually like a really well researched and proven way to solve a lot of this. And we're just not going to do it. Cool. Support your progressive leftist who's running for office. And bother people who are in office who are not doing progressive shit. Ta-da! Did we solve it? I think we solved it, gang. Pat yourself on the back for listening to a podcast that solved it. Pat yourself on the back, and thanks for sticking with me for an hour and 15 here. But do take action that will matter more than listening to a podcast. I will also do that, because we are all in this together. In the sense that we have to continue to tear down the crumbling empire and have something better that's community-based. So that's us. Take care of yourself. Take care of somebody else. I'll be back next week with another new episode. Take care, y'all.